I can't hear anybody.
The presentation doesn't start until just after 2:30, so we're at 2:28. I'll make sure to make announcements as we go. We might start a minute or two after 2:30, but it's 2:28 now, so it'll be just a bit.
Sorry, Jim, it said talking, so I thought I couldn't hear anything. My apologies.
Good afternoon, folks. We will wait in just a few minutes. We'll get started. We're going to get started somewhere between 2:32 and 2:33. So just a minute or two from now, we'll get started to make sure we give everyone a chance to log on. So please stay tuned, and thank you to our ASL interpreters today. If you've just joined us, we're going to be waiting just a minute or two. We're going to start at 2:33 just to give folks a chance to log on. So please bear with us, and we will begin in just a moment. And it's time to get started. Thank you so much for joining us today. I'm Jim McAleer. I'm one of the co-chairs, along with Jack Light from the Caregiver Resource Center, for the Orange County Aging Services Collaborative. I also chair the Orange County Strategic Plan for Aging. We'll talk about both of those today and our most current data report on seniors in Orange County. So thank you very much for joining us. We can go to the first slide on housekeeping. You're in listen only mode. Use the question and answer feature to ask questions. We will be waiting until the end of the presentation to engage with the questions, but feel free to go ahead and use that Q&A feature as we go along. The webinar is being recorded and the link will be mailed to all the attendees, and you are welcome to share that to those who might not have been able to join us. We particularly want to thank our sponsors today, without whom our data report and then this Zoom would not be possible. So Equity and OC has been a huge funding partner. It's an initiative by the Orange County Healthcare Agency. We're very grateful for their support. I'd also like to thank our Orange County Aging Services Collaborative members. We have over 35 members, so I won't read through all of us, but without our membership, we wouldn't exist. Without our membership, this report wouldn't exist. Can we see the slide of memberships, please? It'll get there in a minute. While we're waiting on that slide, the Orange County Aging Services Collaborative has been around for almost 15 years. The Orange County Strategic Plan for Aging was created about 5 years ago. We focused originally on some strategic planning, but as the county engaged more, they have their own process for developing a strategic plan now. We switched a bit. We become more focused on gathering, collecting, coordinating data on seniors in the county. Part of what you'll hear today is there's not a lot of coordinated data on seniors in the county. What does exist doesn't always translate, where one organization talks about apples, the other is talking about oranges. So we still have a lot of work to do on the coordination of data. There's a list of our members. I encourage you to check them out. You can also find us on our website at the OC Aging Services Collaborative.org. This report has been supported and sponsored by the Strategic Plan for Aging and its Leadership Committee, and has been thoroughly supported by the Orange County Aging Services Collaborative members. Our mission, create and maintain an integrated network of services that address the needs of older adults and their caregivers. As I said, the report's good, but it's got holes. We'll hear a little bit about that today. Perhaps you saw the article in the Register that talks about the need for better data collection and collaboration. We hope to make this a living and breathing document. This is our third data report. We hope to issue this on a regular basis so that we can keep updated on what's happening with seniors in the county. I particularly want to thank Gerofusion, who did a phenomenal job pulling this report together from a lot of different sources. I'd like to thank Jocelyn Rubio, who coordinates both of our organizations for us and does a great job, along with her wonderful support person, Amanda Vink. Thanks to those folks and our community partners. Now, you're not here to hear me talk, so let's go straight to our first speaker from Gerofusion, Laura Zettel-Watson and Melanie Horn-Mallers, to talk about the data landscape. Thanks again, ladies. You're up.
Thank you so much for having us today and for giving us the opportunity to work with this incredible group of people. I'm Laura Zettel-Watson, and I'm here with my partner, Melanie Horn-Mallers, and we are Gerofusion. We are a consulting firm that works with, in this case, nonprofit organizations to succeed in our mission, which is to try to make this world a better place for aging adults. And so this was a project near and dear to us, and it's been incredible to be working with all the folks involved. We were hired to collect and aggregate data from Orange County service providers to create an overall portrait of demographics, or what we call demographic characteristics. These are things like gender, ethnicity, age, which is critical information to better draw conclusions regarding the overall needs and well-being of older adults in Orange County. Understanding these demographic components helps to ensure we are preparing for changing trends in our population. We're so grateful for the support and data that were provided to us. And as I mentioned before, it was incredible to be part of the process and to really see all the amazing work being done for our aging loved ones in Orange County with all of the partners that Jim just showed to you on that slide. So we were charged with collecting data from participating agencies with the overall purpose of gaining a more refined lens of the nature of services provided, as well as program delivery processes for older adults in Orange County. And such data can then be used to identify critical gaps and limitations in service provision to our Orange County seniors, hopefully ultimately informing policy, strategic planning, and communication efforts between agencies. So as you may know, last year's report presented data on 3 key areas. That was the digital divide, food insecurity, and social isolation or loneliness. And this year, 2 additional areas were included: transportation and housing insecurity. And in the report, we also included data on what we termed 2 pervading factors, kind of as an overlay, looking at how disability and Alzheimer's disease affected each of those areas. So I'll turn it over to my partner, Melanie, to go through some of the details.
Thank you, Laura. Thank you, Jim. And nice to see some familiar faces. Jocelyn, as requested, just wanted to bring your attention to where we are in the document. For those of you who hadn't had a chance to read it, or look at it, it opens up with a little introduction about California and Orange County in general and how our specific population reflects or compares. The current report, as you can see right in the middle of the screen, again summarizes what Laura just talked about. And then on the right side of page 3, we also listed those agencies that were able to provide tremendous time and energy to give us working data. Now, we were able to collect 53 data files, and these were comprised of raw data files, like Excel files, summary reports, pictographics, survey findings, and white paper reports. A few of those pertain specifically to California as a whole and not specifically to Orange County, but when relevant or accessible, we try to draw upon some of the non-raw data files. What we'd like to just briefly share with you today is that the majority of the data were from the past 12 months, and a few agencies, however, submitted data for just a month or 2 or included data from the previous 2 to 3 years. So we did our best to try to compile the data and create a composite that was most current, most recent, and most reflective of the data that was provided to us. Data represented 44 Orange County zip codes, though some participating organizations did report that they provided services beyond Orange County, a couple in other states, but mostly Northern California and surrounding counties to Orange County. Participating agencies ranged from county-wide providers to more niche or small organizations with a singular mission. Some served only older adults and others served residents of all ages. Of note is some agencies did not record information on the ages of their clients, while other databases included persons of all ages, as I just mentioned. Now, the reason I bring that up is because, as Jim alluded to, there were gaps in the data, gaps in data collection, which we'll talk about later. But based on these gaps, Laura and I did our best to draw out the data that specifically focused on persons in Orange County who were 55 years and older. Whenever possible, we did disaggregate the data and we excluded data when possible on children and younger adults. Overall, then, to best capture the experiences of aging adults, we tried to create analyses that included, again, only data on 55 years and older. And I reiterate that because some of the data that was provided, as I said, covered people who were in their 40s, 50s. Some data only provided persons over 80. And so we tried to create a parameter and a cutoff point so that we had a shared focus to start from and defined aging as 55 years and older. Now, the report also, as you'll see as our other speakers go through, break out the findings into different pillars or different areas of concentration. And so I won't continue to share the screen there, but I want you to notice also when you do get a chance to read it, sprinkled throughout the report are some of the qualitative findings that some of the agencies reported, some of the strengths of the agency support. For example, here's a spotlight on service success. And also throughout the report, sprinkled in were more bold-faced commentary on some of the limitations of the data. But let me just highlight a couple of the strengths. For example, it is very clear that service providers are passionate, dedicated, and very in tune with the clients that they do serve. The quality of the data in the sense of trying to capture if they're getting the services needed, the intention was very clear. And it was very clear that when services were provided, the clients were grateful, appreciative, and their needs were met. Unfortunately, in terms of data analysis, there were quite a few limitations, and it wasn't a reflection of the agencies. Our interpretation is that this was really a reflection of the need of the county to coordinate efforts to draw on more macro level data, to have some consistent demographic information, for example. And later on, when questions come up, we're more than happy to elaborate on the suggestions. Another example is to ensure that we're defining old the same way. But those suggestions, as well as anticipation of changing demographics and how our county can better meet those needs through data collection, are discussed at the end of the report. Again, on behalf of GeroFusion, just want to thank all of the agencies for, again, hours of working with us and getting us any data that they did have. We know how difficult it is to collect, track, and then sort of analyze the data. And we were just really grateful we were able to be part of this experience.
Thank you very much. As we move on to our next section, I remind you, please use the Q&A feature to ask questions as we go along, and we'll try at the end to kind of sum up and get to as many of those as we can. I think it's really telling if you read the article in the Register once again, or you heard what our friends from GeroFusion have said, there really is a lack of coordination of data in the county. I think you'll see our group in coming months and years work even harder to help coordinate and develop that system, and to call on the county to participate heavily in trying to figure out how to get one repository of information so we can know where the gaps in service delivery are, where we're strong, where we're weak, what people need, and who those people are. It's going to be incredibly important as we start planning for our future. The 65 and older population is the only growing demographic in this county. We are not prepared for the growth curve that we're seeing coming. We're going to need data to become prepared. With more information on two other topics, the digital divide and food insecurity, I'd like to direct your attention to Jocelyn Rubio, who's done a great job on this report. Jocelyn, if you go straight from digital divide into food insecurity, and I'll pick it up after that. Thank you.
Thank you, Jim. Hi, everyone. Thank you for joining us today. Okay, I am sharing my screen. There we go. All righty, so the digital divide. The digital divide refers to the gap between individuals who have access to technology and those that do not have access. Although we are aware that COVID-19 exacerbated the divide, there is no county data to show us the impact. In 2021, county level data showed that 94% of older adults in Orange County have internet access, and recent data provided from one agency for this specific report shows that close to 100% of their participants have access to internet and Wi-Fi at home through their cell phones. However, with the data provided and the county not having data stratified by race, ethnicity, income, disability status, and other factors, we were not able to do a full composite of technology usage, which is very important in order to better understand and explain inequities and eventually close the digital divide. Now, in regards to food insecurity, that is defined as a person or household's occasional or consistent lack of healthy and nutritious food, which is a barrier to living an active and healthy lifestyle. Unemployed individuals and those living below the poverty rate are at high risk for food insecurity. Black and Latino older adults are 4.7 and 3.1 times more likely to experience food insecurity compared to white older adults. However, there are other factors that contribute to food insecurity, such as mobility limitations, veteran status, and mental health conditions. For those older adults living on a fixed income, they may have competing finances and their money may go to rent for 1 month, or they may have to pay for specific medications or a medical bill and not have enough food for food or within their budget. Food insecurity is not only among older adults under the 200% federal poverty level, which equates to less than $30,000. Feeding America now estimates that 33% of the now 51,000 food insecure individuals in Orange County are above the 200% federal poverty level. But what about government funded or subsidized programs like CalFresh? Well, although CalFresh indicates that their older adult enrollment grew in the last 2 years by nearly 42%, such programs are currently facing government spending cuts, and we don't know to which extent that will affect Orange County's older adults. Food insecure older adults have higher rates of multiple comorbidities, depression, frailty, living alone, being homebound, disability, and social isolation. As the older adult population increases, Orange County needs to be prepared for significant increases in food insecurity rates. It is important for organizations and government agencies to have a systematic approach in order to track the numbers and learn which groups are receiving assistance and which at-risk groups remain underserved. And I'll pass it on over to you, Jim. Thank you.
Thanks so much, Jocelyn. So we're going to move on now to our very good friends at the Council on Aging Southern California to talk a little bit about social isolation and loneliness with Carolina Gutierrez Rehau. Carolina.
Thank you so much, Jim. Let's start with some definitions. Social isolation is defined as a lack of social connections and having maybe fewer people to interact with on a regular basis. Loneliness, on the other hand, is the feeling of being alone, regardless of the amount of people or social contact that one can have. Loneliness is also described as the feeling of isolation, not belonging, but lacking companionship and support. While social isolation and loneliness are different, because it is possible to feel lonely when living among a lot of people, or being perfectly content with living alone and not feeling lonely, both social isolation and loneliness often are mutually inclusive. According to some of the research that you can see in the report, there has been an established link between social isolation and loneliness due to several biopsychosocial factors, including advanced age. As older adults, social network is an essential component like for everyone else. As people sometimes get a little bit older, this network start thinning out, and that support of belonging gets impacted by multiple losses, such as retirement or the end of a successful job career, disability, transportation barriers, the deaths of family members or the friends. Also living alone. While living alone by itself, as we mentioned, is not necessarily an indicator of feeling lonely, adults who live alone can be disproportionately affected and might have a higher risk of isolation by external environmental factors. And we all just saw these during the COVID-19 pandemic. Research also shows that having fewer social connections increases the risk of chronic conditions such as high blood pressure, heart disease, cancer, disability, depression, cognitive impairment, and premature death. And also something to take in consideration, especially in Orange County with the social rich, diverse cultural backgrounds that we have here locally, is to look at cultural barriers. The report also highlights the cultural barriers, social language barriers to access information, technology, or social engagement activities are a factor to social isolation. I think that it was mentioned before as well, I think Melanie shared this, that due to some data limitations and lack of standardization in the samples, this report doesn't necessarily provide direct data on social isolation and loneliness. However, the high quality measurements from the National Social Life, Health, and Aging Project, is a mouthful, shows that 21% of adults 50 years and over in Orange County are at risk of loneliness. In addition, I wanted to take a look while we're presenting this report at some of the local data in regards to the risk factors of indicators that we were just mentioning before, because that will help us appreciate the importance of focusing in decreasing loneliness and social isolation among older adults. There's data that shows locally that 22% of adults aged 65 and older in Orange County live alone, which might be a risk of social isolation. Also, the disability rate in adults aged 65 to 75 years old in Orange County is 18%, and that more than double when a person becomes 75 years old. The rate is 46%. In addition, we can also see that older adults have the highest rate of suicide in Orange County. And this has been documented in the latest this year and last year reports of deaths of suicides that has been produced by the healthcare agency. Within this population of older adults, the highest rates of the priority population to the prevention would be Caucasian individuals, men, individuals 65 and older, and LGBTQ+ adults. I don't want to end without a positive note, and I do want to say that the Orange County Strategic Plan of Aging from its inception has focused on addressing social isolation, and that there is a social engagement committee that is very active and that any members of the community and agency can participate. And that will be all in this section. Thanks, Jim.
Thank you so much. We really appreciate that. As we move on, we're going to go to one of my favorite organizations in the county, Abrazar, and their CEO, who truly knows more about transportation than many, Mario Ortega. Mario. Mario, I think your mute's on.
Hey, guess what? I'm
There you
unmuted.
go.
Everyone, thanks for joining us, and we're going to go through our speed dating presentation right now. So it's we have 5 minutes, but I wanted to present about transportation because transportation is so vital. I'm going to go ahead and actually share my screen on the report section for transportation. Let's see, here we go. Okay, I think we're good to go there. But really, when we talk about transportation, transportation really is about access, and it is about equity. If people cannot get to their medical appointments, if they cannot get to programs where they're going to socialize, if they can't access food at a food bank or the grocery store, that is, all those impact a person's health. So all the social determinants of health that we talk about and that are in this report, transportation is tied to all of it. And so, you know, when a lot of people ask of what they think of Abrazar as a transportation company, and we're not. We're a nonprofit organization. We're proud of those efforts. But the reason why we did it is because we saw a gap in service in the community. And it's great if you have a lot of programs available to the community, but if they can't access them, or the services that are available currently are not adequate, either they're culturally inadequate or service-wise are inadequate, then the community is not going to be able to utilize those. And all the studies have shown that if people are not going to their medical appointments, if they're not going to socialize, if they're isolated, if they have problems accessing nutrition and food, all those impact someone's mental health and actual physical health. So what the highlights on this report have shown is that we need more data. I know, because I'm in the field of that, there is more services, gap services that are out there in the county. But all of that is anecdotal, or I see it also through the requests that are coming in, either through partners or through community. But what we need is more actual data for it. I'm going to quote Kalita Gardner. She's from the HEAL OC. She had a great quote that Advance OC now has been putting on their t-shirts, and it says, "In God we trust, everyone else needs to bring data." And so we do need that. It's a great quote. And because that will help solve so many of these issues to see what are the gaps in service that are needed. So in the recommendations in this plan, it's that we need a consolidated effort led by the county to bring together all these creative, innovative nonprofit CBOs, like a lot of us here that are present and a part of it, to look at the gaps in service and whether the services are adequate. And if not, what can we do to address those? I think some of the recommendations are there are some great pilot programs that are out there right now, but they need to be expanded. And these pilot programs are using partnerships with CBOs, adult day healthcare centers, and the county to work together to provide culturally competent, linguistically competent services to the community. I do want to highlight that there are, on a positive note, there are a lot of creative programs that are available out there, innovative, that are addressing some of these. The problem that there's just not enough. So we need to expand those efforts with it. And some of the, I want to do some of the stats that we have in the report as 1 in 5 Americans that are 65 and older do not drive. So think about that population. How do they get to their medical appointments? How do they get to socialization? And with the growing population, that need is just going to grow. So if we don't start planning for it now, we're actually, I believe, in my opinion, we're already a little bit behind. We need to get this started fast to be able to mobilize all of our all of the creative ideas and solutions from CBOs, working with the county to come up with a plan to address the services and determine the gaps in service that are available right now. I do want to highlight, because this section it resonates with me because we provide these services. But one of the highlights in the program, the transportation in the report on page 8, it talks about a family that needed access to be able to go to the adult daycare center, and they did not have they did not have a vehicle themselves that was adequate for a wheelchair to accommodate, and they also could not pay for a private transportation. It's so expensive to do it, but they partnered with a local nonprofit to be able to provide services for them to get to the adult daycare center. So why is that important? Think about it. Someone that's going from being at home now is able to go to an adult daycare service. They're able to get monitored for their medical conditions. They're able to get nutrition. They're able to socialize. So all of that impacts someone's health. So we want to utilize these kind of programs to address all the gaps in the future. With that, I think I might be a little bit over. I did look at my timer. I know Jim is a stickler on it. So with that, I will stop. But we would love to be able to partner with everyone and with the county to come up with these some new ideas and look at the service gaps that are affecting the older adults and disabled community in regards to transportation. And I'll give it back to you, Jim.
Thanks very much, Mario. I am a bit of a stickler, but the content is way more important than timeframes at this point. I think Mario brings up a really fascinating point. Our community benefit organizations, our nonprofits, are uniquely positioned to have an impact on anything related to seniors in the county, more so than most governmental entities, even healthcare entities, because we have very specific lens into very specific populations. So I'm hoping that we create a system whereby all of us in the county can come together, relying on the networks already existing through nonprofit CBOs and leveraging those. Speaking of leverage, we're going to go back to the fantastic Jocelyn Rubio to talk about housing insecurity. Jocelyn.
We go. All righty. Thank you. Okay, so housing insecurity. This is one of the new key areas to the report. And we didn't gather much data, but there are still a lot of great points in the report. So housing insecurity can be defined as limited or uncertain availability access or inability to acquire stable, safe, adequate, and affordable housing and neighborhoods in socially acceptable ways. There's a researcher, or an NYU researcher, Giselle Routhier, who also mentions that some variables include unaffordability, poor conditions, overcrowding, and forced moves, which I think we are seeing a lot currently. But unfortunately, mortgage debt among older adults has skyrocketed. One study reported that by 2035, 6.4 million renters and 11 million homeowners will be cost burdened and 8.6 million as severely cost burdened, spending more than 50% of their household income on housing. So think about that when an older adult is living on a fixed income. Carrying debt into retirement will make it difficult for home modifications and repairs, which can lead to unsafe housing conditions. In California, the unhoused population is increasingly composed of older male adults. In the fiscal year 2021 through 2022, 40% of unhoused single adults 50 years and older were referred to the homeless response system, 50 years and older. And in 2022, nearly 11,000 veterans were homeless. Unfortunately, older adults are the fastest growing unhoused population. Although between 2019 and 2022, Orange County saw a decrease of 17% in overall homelessness, but the number of unsheltered adults with physical disabilities, mental health challenges, or substance abuse issues increased during that time period. One agency reported that their clients believe more affordable housing and housing insecurity and homelessness are areas of improvement in their community. And lastly, housing insecurity is more than homelessness. It includes many factors associated with home ownership and aging in place. Thank you, and I'll pass it on over to you, Jim.
Thanks, Jocelyn. You're getting a course in speed talking today. You're really zipping through it. Thank you so much. I'm particularly pleased to have our friends from Easter Seals here and Kathleen Kalenda to talk about the impact of data and what's happening in the world of folks who experience a disability. Kathleen.
Thank you, Jim. I'm going to share my screen with page 10 of the report, where we start with pervading factors and disabilities. And pervading means to spread through and be present throughout. And certainly disabilities are present throughout our older adult community and all of the sections of this report that you heard about today. And I think there wasn't one speaker that I didn't hear mention disabilities related to their topic area. And here in Orange County, and for the purpose of this report, we're referring to disability as a physical or mental impairment that substantially limits major life activity. And for the purpose of this report, we did include people with lifelong disabilities as well as older adults with disabilities. And it is pretty certain if you live past 85 that you will experience a significant major disability. And as we know, many seniors experience disability prior to that age. So with longer life expectancy and the increasing number of older adults aging with some type of disability, I think this report was essential. I think that the data, needs to continue to be gathered. And I do think when it comes to disability, as is noted in the report, the countywide estimates were under the reality of the numbers. And I think there's a lot of reason for that, but I think the number one reason is the stigma related to disability and the fear of loss of independence when you identify as a person with a disability. And that can be many different categories of disability. So I do believe the countywide estimates, are probably higher than we recognize. The report references where people with disability live, And I think that that's noteworthy. It compares South County and North County. And I think that goes along with what some of the other speakers referenced, is that many people with disability live in poverty. And we know the housing costs here in Orange County are prohibitive for many people with disabilities. We have a lot of people who live in boarding cares and group homes in Orange County, and those can be found primarily in Central and North Orange County because of the cost of housing. Also, I think it's important to remember that we had Fairview Developmental Center here in Orange County for decades, housing thousands of people with lifelong disabilities. And those folks now live in the community as well. So the numbers of people with disabilities in Orange County is quite staggering, really. And I want to just carry on with what Jim was saying about our CBOs in Orange County. I think we have excellent disability service providers supporting people with disabilities across the lifespan. I would draw attention to, failing here to move my report, to page 11 and the Spotlight on Service Success, where it tells of a person, a younger adult, 37 years old, with disabilities, who through the collaboration of several organizations in the county and the cooperation of all, this person's lifelong goals are being achieved. So I think that that's something to recognize, that we really do have great service providers. And I think in the disability community, I might just say that people have deep experience with disability prior to aging, and certainly with aging as well. And so I think, that definitely has something to contribute when we're in a collaborative like this, focusing on older adults and disability related aging issues. So lastly, and I want to look at my time too, I just want to mention that I think all of these services are possible with people to do the direct support. And that's a major factor in our county, I think, because of the cost of living and the needs of direct service people. So that's something that we want to really to continue to focus on as a collaborative, and how we make service industry for older adults and people with disabilities a career path that people want to pursue, and how we educate and really elevate that career so that we can do all these wonderful things in Orange County with this growing population. And I'm going to turn it back over to Jim to take on the next section. Thank you.
Thank you very much, Kathleen. It's really fascinating to see where some of these trends are progressing. One thing that's across all the spectrum seems to be that the trends are progressing to greater numbers, greater need, and more things that we should be looking at. So in my day job, I'm the CEO at Alzheimer's Orange County. So a lot of what we look at has to do with memory impairing conditions or dementia. So we just released a report about 2.5-3 weeks ago about the incidence and prevalence of dementia in Orange County. In 2014, we released our first report on those numbers based on the census at the time. 84,000 people who had dementia or who were at immediate risk. Now, at that time, at immediate risk did not mean having mild cognitive impairment. It's just what research told us was the number of folks, the percentage of people who were likely to develop dementia in the next 5 to 10 years. Well, now we have a much better understanding, not only of how many people, percentages, experience dementia, some form of dementing condition, or who have mild cognitive impairment. We've got a much better grasp on those numbers nationwide. Now, as I mentioned earlier, Orange County is an older county. 65 and older is our only growing demographic. It's projected to grow, get this, 27% of the total OC population will be 65 and older by 2060, 27%. So where are caregivers going to come from? Because a lot of them are leaving the county because they can't afford to live here. So we're looking at some pretty significant societal changes and needs coming down the pike, if you will. So our new census helped us come up with a new number. Remember, we were at 84,000 in 2014. We now know that in Orange County alone, there are 164,346 people who have dementia or mild cognitive impairment. I'll say it again, 164,346 people in just Orange County who have some form of dementia, Alzheimer's, vascular dementia, Lewy body, frontal temporal, any one of the many, many dementias that exist, or mild cognitive impairment. That's a pretty massive growth curve. The Latino community, the Vietnamese community, and other multicultural communities are harder hit than the Anglo community. That's part of the reason actually for the big growth curve. This county is actually increasing its diversity. It's not becoming more of one group, it's actually becoming more of many. And those groups tend to have a higher percentage of dementia for a variety of reasons. We believe it's diet and lifestyle. It's also how they're aging in the space. Folks in those communities are trending older. They also have a higher percentage of women. Women are more likely to experience dementia, partly because women are going to live longer than men based on statistics. So when you put all those factors together, you get a sense of just how large the scope of the issue is here in Orange County, and it's 164,000 people. We use studies from Columbia University. We did cross-correlation with well-known National Institute of Health studies, among many others. We used over 8 well-known studies to figure out these numbers, overlaying ethnicity, age, gender, and came up with what was a stunning number. So as we look at the issues that this creates, it's not just dementia, it's any kind of seniors experiencing health conditions. Most often they're comorbidities. Diabetes exists in concert with the dementia, or you have vascular dementia as well as Alzheimer's dementia. And they create true caregiving and lifestyle concerns that we as a county are going to have to increasingly put more and more attention, more time, and more money into trying to figure out what we're going to do with it. So I do see some questions, and it's time for us to go to some questions and answers. And I see some responses. So I'll start with the first. Thank you, Deborah Morse, for asking, is there current legislation to fund transportation, block grants, for example? Mario responds, OCTA, Orange County Transit Authority, has a few federal grants that come out periodically for nonprofits or CBOs. The largest one for nonprofits is the Enhanced Mobility of Seniors and Individuals with Disabilities, known as Section 5310. It also, Deborah also asked, how are the current nonprofits providing transportation funded? Again, from Mario, we'll see that we apply for different funding sources to provide services. They include city, county, federal, and private foundation grants. So I'm actually going to ask Mario to step in with this series of questions from Deborah and just see if you'd like to weigh in any more on the funding for transportation services, Mario.
Sure. Yeah, it's one of the things that is frustrating about it is that it is so important service that's needed, but it's not really an attractive program to fund. So it makes it difficult if you're a service provider trying to assist in solving this problem to get funding for transportation. And also there's a misconception that the public transportation that's available, whether it's a specialized from OCTA using like access services, that is enough or sufficient to meet the demand, and that they should be able to provide it for everyone. But we know it's not. So it is very time consuming. It's very difficult. Also, the funding for it on some of the contracts that we actually are providers for, it has not caught up to what is a reimbursable rate to provide services that actually do not make an agency, a service provider, be in the red, in the negative to assist in providing these services. So we actually have to fundraise in addition to the grants or the services and the contracts that we have to be able to sustain those services. I think that has to be part of the gap analysis, is that you can have these great programs and service providers, but if it's not funded or reimbursed at a rate that is adequate to sustain the services, and then it's gonna go by the wayside. So yeah, it takes a lot of time, too much time, but it's important. It's needed. So we look at every potential source to help with that service.
Thank you, Mario. We also have a question from Gregory Mathis asking, can you please discuss the collaboration with the forthcoming county master plan on aging? Of course. So the county issued an RFP, which was responded to, and it's being directed to a fantastic nonprofit. As they do their work, they're doing different surveys, they're doing different forms of in-person polling, they're doing phone surveys, they're also meeting with a lot of nonprofits. Many of us have met with them to talk about what the needs in our specific spheres are. A lot of other nonprofits are yet to meet, but will. So we'll be as involved in the planning of that as we're allowed to be. We certainly have had open doors so far. We look forward to having further conversations. I agree, by the way, Deborah, that transportation needs are quite high up the list. Carol Dupay asked, how can people find mental health services available to older adults in OC? I'm not a specialist in mental health. Carol, perhaps you can answer it better than I. I do know that the Be Well initiative, funded in part by the county, has been a very, very active partner in mental health. Amanda, would you like to take that question on, please? Amanda, are you with us?
Hi, hello. My mic cut out. Could you repeat the question?
How can people find mental health services available to older adults in Orange County?
Yeah, so we have multiple service providers that do have mental health services. There are a few, a lot of them are social isolation related. We have the Council on Aging. Like Jim said, we have the Be Well organization. We also have many others. We will be sharing the presentations today, so you can go through our member organizations and get in contact with them. And that is all I have. Jocelyn, would you like to share any other organizations that have mental health services?
Yeah, so at the end of the report, you will find the list of the OCAS, the members, the collaborative members. And I am aware that Be Well has like an older adult mental an index training that offers other organizations training. And there's also which is not directly towards mental health, but the Older Adult Behavioral Health Council. So if anyone's interested in that, we can send that information over to you.
Thank you. And also, as Vivian Kiani notes, Older Adult Services, and she puts the number into chat. I don't have information, Deborah, on the status of new low-income housing in the county. So I would ask our panelists or Jocelyn, if anyone has current information on new low-income housing developments or multi-family facilities specific to seniors in the county. For questions that we're not able to answer today, we'll ask our team, Amanda and Jocelyn, to reach out to the folks who are in that industry, Jamboree Housing and others, and we'll get a question and answer sheet with some of these out to you after. I'm not seeing any other questions, so one last check-in. I very much appreciate the time of our panelists today. I appreciate your expertise. I appreciate the very good work you're doing out in the field. I'm particularly appreciative of Jocelyn and Amanda's good work, as well as Gerifusion in pulling this report together. It did take quite a lot of work pulling information from many, many sources, and I think they did a remarkably good job. We'll now have it both printed and available electronically. We'll be reaching out to our elected officials through both city, state, federal, and county to make sure that they're aware of what the report says, and notably what it doesn't say, so that we're able to try and advocate even more strongly for better, more cohesive data collection, analysis, and presentation. We'll continue our work on data reporting, and hopefully we'll be able to provide increasingly cogent and directed data reports in coming years. Thank you again for your time today. If you have any further questions, comments, or interest, don't hesitate to reach out to myself or Jocelyn or any of our panelists. And you can see the emails there, contact@ocagingplan.org, or to access the report, www.ocagingplan.org. Again, we appreciate your time, and for our sign language interpreters, we appreciate your efforts and time as well. Have a good day, folks.